Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, flashcards, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I have been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 50-year-old male with a history of obesity, hypertension, and a family history of diabetes presents for a routine physical exam. His fasting blood glucose is 130 milligrams per deciliter, and his A1C level is 6.8%. The NP student inquires if the nurse practitioner needs any further testing for a diabetes diagnosis. What is the best response by the nurse practitioner? Is it A, no, a positive fasting plasma glucose and A1C meets the two required for diagnosing? B, yes, an oral glucose tolerance test. C, yes, a random blood glucose test is needed as well. Or D, repeat the A1C measurement. Take a moment and tell me what you got, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the best response by the nurse practitioner? So what are we responding to? So we have this 50-year-old male who comes in. He has a history of obesity, hypertension, and a family history of diabetes. His fasting blood glucose is elevated at 130. A1C is elevated at 6.8%. And the MP student is inquiring to the nurse practitioner if there needs to be any other testing to determine the diagnosis of diabetes. And your best answer here is A, no. We need two glucose readings, right? We need two not two glucose readings, but two of the criteria needs to be positive to confirm that diagnosis. So they have the 130 milligrams per deciliter for the fasting blood glucose that is positive, as well as the A1C being greater than 6.5%, being positive. So that's all we need for the confirmation of that diagnosis. Question number two. A 58-year-old female is diagnosed with type 2 diabetes based on an A1C of 8.5%. She is overweight, has no history of cardiovascular disease, and is not on any medication. According to the American Diabetes Association's guidelines, what is the most appropriate first-line treatment for her diabetes? Is it A, metformin, B, insulin, C, sulfonylureas, or D, your GLP-1 receptors? Take a moment and tell me what you got. All right, so similar question here states, what is the most appropriate, according to the ADA guidelines, what is the most appropriate first line treatment for her diabetes? So that right there is all you need to know, right? What is the first line treatment for diabetes? And you should instantly think A, metformin. All right, and lastly, question number three, a 65-year-old male with type 2 diabetes presents for a follow-up appointment. His current A1C is 10% despite being on metformin. He has mild hypertension and is overweight. What is the next best step in managing his blood sugar? Is it A, add a thiazide, is what I call it, because I butcher this word all the time? But it's thiazolidine ziones. I always have to slow down and say that word. B, increase the dose of metformin. C, add a GLP-1 receptor. Or D, start insulin therapy. I don't even know why I played with myself and put that answer choice on there for y'all. I should have just said sulfonylureas and stop making this difficult for myself. This is how y'all know that I invest in these questions enough to help y'all more than making myself look crazy and butcher words. But anyways, tell me what you got on this one. All right, so similar question states, what is the next best step in managing his blood sugar? So, all right, what do we have going on? Because we're talking treatment and we're trying to manage your blood sugar. So it's a 65-year-old male with type 2 diabetes. He's already on metformin, but his A1C is 10%. And we're trying to figure out how to better manage it. But you should instantly know when we get to an A1C of 10%, you want to start insulin therapy, right? So D is your best answer. All right, you guys, as always, I hope you found this helpful. Please be sure to like, comment, and subscribe and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number one at gmail.com. Now, everything that I do offer, from my review book to my Q Bank, my flashcards, are all included in the bio of this channel, as well as my website. And if you're looking to book any one-on-one sessions with me, I always say either call, text, or email, as I offer a variety of session types, and I prefer to speak with you to gauge what you truly need to make sure you're booking the appropriate session. All right, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.